I'm going to just give you a little bit of a 5-minute whirlwind tour of the lay of the land. I think for those of you that don't play in the ASC space, you really should get serious about thinking about it. I think as we go forward, it's going to become more and more important in what we do and how we practice our spine care. So of relevance, I work with TriusMD, which is, you'll meet Jim Becker in a minute, who's the CEO of TriusMD, which is a surgery center company with a focus on spine. So I'll tell you how the world's changing. So hospitals are really sort of a historic model. They do everything for everyone. It's an archaic model from the days of the 1800s, really designed to treat rare and complex disease. It's really not the ideal place to do high-volume elective procedures on healthy people, which is a lot of what we do in terms of our elective spine practices. And as we see when you read Becker's, no connection to this Becker, every week, you see hospitals going broke all the time, and they're not very efficient, and really these artificial sort of protections like constraining competition and administered prices and all the regulations that protect hospitals, most of them probably wouldn't survive. But they would like to keep our procedures there because it subsidizes the unique low-volume complex problems that we do need hospital to treat. And at the same time, they have tremendous political clout, sort of apropos of some of the discussion with RushCHI, our attorney, this morning. So why ASCs for spine surgery? There's many studies showing incredibly high patient satisfaction. A lot of data showing they're safe and efficient. The economics we'll touch on in a second are compelling for all stakeholders. And as the surgeon, you control your environment. If anesthesia sucks, you fire them and you hire good anesthesia. You know, you can control implants, so you really have much more control over your environment. So the safety is well published. We're not going to go on about that. We've published, others have on fusions and extensive other publications on the safety in the ASC setting and appropriately selected patients. And the push towards it is largely patient-driven, right? We see a lot of suddenly the consumer in medical care has become more and more critical to the decision-making process. Patients have higher expectations, particularly as more of the financial burden of their care is shifted back towards the patients. They want to be informed and make decisions. And they like the ASC. It's a specialized environment. It's predictable schedule. You're not at the mercy of a busy hospital schedule with rooms overlapping and adding on emergencies. So I think this sort of push towards consumerism in healthcare is really going to drive that same push to ASC that arguably are much more consumer-oriented centers of care. And it's sort of the decentralization model, right? You used to have the old mainframe computers in basements, and we evolved to more mobile, more convenient systems like the iPhone. And it's the same thing, right? People don't like going to the middle of downtown, having to pay $50 in Chicago for parking to be at a big medical center. They want the center near them, convenient, easy, more convenient, lower costs. And that's what we've seen that move in every industry. And I think we're seeing that more and more in what we do in spine care. And if you bury your hand, the writing's on the wall. The ship sailed, right? SCA, bought by United Healthcare, Optum, huge control. You heard today, 10% of doctors in the country are employed by or work for United Healthcare, Optum. So Tenet, USPI, who are probably the biggest ASC company in the country. So the payers and the ASCs are in bed together. So the fact is, you're going to be left behind if you don't seriously think about in some way participating in this changing environment. And we've seen this migration to outpatient. Lumbar fusion's been slower than I think we'd expect, but certainly cervicals in a big way move towards the ASC. And even taking out the sort of convenience, selfish aspect, it's a huge deal just for overall cost of healthcare. And here's some numbers there. Say 50% of eligible Medicare procedures were moved to the ASC. It would save the system $2.4 billion a year. And shifting site of surgery is probably the biggest potential cost-saving measure in healthcare in the United States. So we have other reasons maybe we like it, but from a big sort of public health point of view, it's a trend that's going to continue because of the economics. This is, I think, a little older side, but most ASCs have at least some degree of physician ownership, and that's how they work. And most in ASCs in general, about 50% of cases are performed by physician ownership, but 50% are not, because even if physicians may not be owners, it's the convenience, it's the ability to control your environment that's attractive, that makes people want to operate out of these ASCs. So just a few anecdotes. So I do almost all of my one-level lumbar fusions in ASCs and have for years. So just two examples, because people, tend to do decompressions and ACDF for cervical disc, but you can do much more, and it's not that challenging. The complications are no different. If you get a foot drop after a TLIF, if you do it in the ASC or the hospital, it's not really going to change your management. So here's just an example from the last couple of weeks. I think a 54 ophthalmologist, not important. So we do an MIS LAMI TLIF. It takes, 100 minutes, and the patient goes home 3 hours later. And our ASCs, we've got no overnight stay. So these are all outpatient, real outpatient ASCs. and the lordosis is appropriate, you can do just what you do in a hospital in an ASC. Here's another example, 4-5 ischemic spondy. So we do a lateral with perk screws, single position ASC, 80 minutes, leaves 3 hours later. Certainly all these cases can be successfully accomplished in ASC, and I had my fellows pull this up this last few years. So we've done 71 XLIF, 50 MIST lift. No cases took more than 2 hours, nothing intra-op. The length of stay is 142 minutes, longest 220 minutes. None of these patients have been admitted for overnight stays to the hospital afterwards, and no returns to OR within 3 months in this cohort. So it certainly can be done in the ASC. So I'll end up there. I'll just say ASCs are the ideal venue for most spinal surgery. There's strong tailwinds because it benefits all stakeholders. Patients like it, payers like it, and I think it's a much happier environment for surgeons. A lot of this move to ASC is enabled by less invasive approaches, enabling technologies, improved anesthesia, analgesia protocols. All that's critical to be able to do stuff successfully in the ASC. And as I said, documented patient satisfaction, efficiency, no difference in terms of complication rates to inpatient surgery. Thanks.